What's going on, guys? My name is Joey Mason, owner of Mason Hills and Four Bulls. We're at the Four Bulls location at Mason Hills, and this is kind of come like our podcast studio where we ask some questions and see if we can get some really cool answers. We're interviewing quite a few people here, and what an amazing experience. Dr. Lightfoot, thank you so much for coming.
Glad to be
I'm
here.
going to introduce, we have an introduction. You already know, but I have a gift for you. It's our
All
steak
right.
butter.
This stuff is good.
Yeah,
by
thank
the
you
way.
so much. Thank
This
you.
is good.
So Dr. Lightfoot, he's kind of like a father to me, and y'all really taken me under your wing and been through a lot of things with me over the last 15 some odd years, and so it's really
It's a real honor to include you in our family. We have 6 kids and 14 grandkids, so it's always good to have you as part of that.
Thank you so much.
The clan.
Well, and hopefully we'll get I'll get started sooner or later and get some more grandkids coming.
Well, that would be good. That would be good.
So Dr. Lightfoot is the founder of Victory Health Partners, born and raised in Montgomery, graduated from the University of Auburn and UAB Medical School, 4th generation doctor, married to Tammy Lightfoot, who is the co-founder of Victory Health Partners for almost 34 years.
Yeah.
Now 14 grandkids. In January 2003, he founded Victory Health Partners, and your mission statement is, as a witness of Jesus Christ, Victory Health Partner exists to minister to the physical, emotional, and spiritual needs of the medically underserved by providing affordable quality health care services. We recognize that God is the true healer and the source of all. We seek to know Jesus Christ, his son, and make him known. Victory Health Partners is a 501c3 nonprofit health organization established under the laws of the state of Alabama to provide how do you pronounce that word?
Continuum. Try that one again.
Yeah, Victory Health Partners. Victory Health Partners is a 501c3 nonprofit health organization established under the laws of the state of Alabama to provide cumulative of affordable quality care for the low-income, uninsured population of the greater Mobile area. Victory does not accept insurance or government funding. That's huge. But it is founded and funded by tax-deductible contributions from its supporters. As stated in the name, Victory Health Partners, Victory is a community partnership of people from diverse backgrounds banding together in friendship and love to provide health care to fellow citizens in the greater community. And Victory Health Partners has around 60 or 70 volunteers that produce about 40,000 volunteer hours. They've done $14 million in 2023 in free medications.
Yeah.
222 neurological appointments and 25 life-saving surgeries.
Yeah.
I don't believe that I'm even sitting here doing this interview. I just interviewed Paul Prine, and now I'm sitting here, like in the grand scheme of things, in 34 counties in Alabama, 14 in Mississippi, and 10 in Northwest Florida, and then Mobile Infirmary only charged you $1.
That's right.
For your facility.
Yeah.
So thank you for coming.
Thank you. And I listened to all that, and I love numbers. I love those kind of here's the fruit of what we've done and how we've helped folks, and that's incredible. And could not have imagined it 25 years ago.
Yeah.
Could not have imagined what God has done, bringing all these people and all these partners, all these specialists, all the medications, those surgeries. That's a separate fund that we have called the William M. Lightfoot, MD Surgery Fund. It's named after my brother who passed away 4 years ago. And, that's a special thing where we really provide life-saving surgeries or procedures for people who absolutely couldn't afford it.
Why? You've told me the story off camera of why you got into the medical field and then ultimately started Victory Health Partners.
Yeah.
Why is that?
Well, I grew up, I am 4th generation doctor, and so I was a hospital rat.
Yeah.
I went on house calls with my dad. I went to the hospital for rounds. I grew up working in the hospital. My dad started me as a orderly, cleaning out bedpans.
Yes, sir.
He was a good man. And moved me on up. And there was nothing else that really was my passion, and I knew that.
Yeah.
And that's what took me to Auburn University and then to UAB and then to 5-year general surgery training, and then came to Mobile because of my brother, Dr. William Lightfoot, to practice with him. And so it's always, I love what I do, which is really important. I just love what I do. I love taking care of people. I love doing surgery. But God had another plan kind of in the middle of my life. My wife and I went to the Brownsville Revival in Pensacola. It was one of those life-changing lordship moments with Christ where maybe he was my Savior, but he wasn't my Lord.
Yeah.
And it absolutely turned us upside down. And from there, we went on mission trips, first to Venezuela and then Guatemala multiple times. And for us, or for me, that was a focus change. That was, you've been doing all these things, most of it really for you, and doing it because this is what you thought you should do. Now let's do something for the kingdom of God. And through an incredible number of goddesses where he took us to places, showed us what we were supposed to do, gave us the model for church, for Victory Health Partners, it became clear that we could not do it. We'd have been disobedient to God if we didn't do it. And then God started putting things together. God's always working behind the scenes. He's done more. This is Victory Health Partners is God's vision. It's been in his mind since long before Tammy and I were here. And we just said yes to it. And he began to unfold all the different connections, all the different people, the building 11,000 square feet of a medical office in kind of midtown Mobile for $1 a year. Only God could really have arranged
That's right.
that. And so we began working on this. We spent, 3-4 years just planning and looking and rehabbing the building. Hundreds and hundreds of people came and volunteered and redid the inside of the building, made it into what it looks like today. And it's a little different kind of doctor's office. There's scripture everywhere you go. In the corner of the parking lot is a beautiful wood cross that one of the workers that was working on the building doing some construction work said that he wanted to do something for us. We said we wanted a cross. So he went to North Alabama, got this special wood, hand built it. There's no nails in it. It's all fitted together. And then brought it to us. And as we were putting it up, we were digging the hole to put the cross up. And we had the Quickcrete ready to go. And said, well, we need some water. So somebody goes and runs to get a pail of water, a bucket of water. And the next time we put the shovel down, the water bubbled up in the bottom.
Oh, wow.
And we placed it, put it in concrete. And that cross is really there. It's more for us. It's more for the staff and the volunteers and for the patients. But it's to remind us why we're there, because we're first and foremost we're a ministry. We kind of joke that, oh, by the way, we love to do healthcare, but that's not what we really love to do. We just love to be able to share the love of God with every person that walks in those doors.
Yeah.
And if they do not sense and feel the love of God in how we've treated them, what we've done, the excellence of our care, then we've missed it, not them. And that's really what we do it for.
And it sounds like in what you're doing in Victory Health, the onus is really on you guys to make sure that you provide this atmosphere that is very inviting, not only to the patients that are going through some of the most difficult times in their lives, that don't have any money they're at an impasse, right? But then also, so you steward the presence really well. And I've been there, and it's just like that.
Yeah, the atmospheres, God's all about atmospheres.
Yeah.
And, it is our job. It's our job to pray. It's our job to to individually, all of us at the clinic, to spend time with God, so that when we come to work, we're focused not so much on the job that we're doing, but on the healer, on Jesus and God the Father. And if we keep our focus on that, everything else will be fine.
Yes, sir.
We lose focus on that, we're in trouble.
Yeah.
But I had a couple just come in the other day, walked in to meet with me, and they walked in and said, this atmosphere is incredible.
Yeah.
You can feel the presence of God here. Well, that's cultivated.
Yeah.
Yeah, that doesn't come just happenstance. It's a great gift of God, but you have to steward it well.
You do, and if you're not doing things right and you're not stewarding the finances well, it's not going to last very long, is it?
No. And we've been very, very particular. God was very focused on who we are to take care of. It's one group of people. It's lower income, uninsured adults. And like you said, we thought at the very first, Mobile, Baldwin County, that sounds really good. Mm-hmm. And now we have, 56, 58 counties
it's a
represented.
Wide reach, isn't
it's
it?
a wide reach. And that's by word of mouth.
And what's the furthest that people have traveled?
Actually had a snowbird from Michigan that came down and would come to see us while they were here during the winter.
Yeah.
But as far north as close to Montgomery, as far east is just past Pensacola, and then you get all the way through lower Mississippi. Mm-hmm. We have a lot of patients from Mississippi that come over, and they drive a long way.
They do.
But it's very hard to get primary care if you don't have insurance. It's almost impossible to get specialty care if you don't have insurance, just unaffordable. And so one of the great things God's done is all these specialty partners, 170, over 175 now. And these are cardiologists and orthopedists and chiropractors, physical therapy, all these things. And they really give of their services. There is a small cost to it, but it's so reasonable, it's unbelievable. And that amounts to millions of dollars every year of basically free service.
Yeah.
But it's, for our patients and for us, it's the next step in healthcare. And it's something that's unobtainable otherwise.
And so a lot of people that watch this YouTube or podcast or whatever the form they watch it in, they have access to affordable healthcare, most of them.
Yeah.
And so they don't really understand what it's like not to. Like some of the folks that work here and some of the people that, serve your McDonald's or serve your whatever are really your patients.
Yeah, they're people we know,
Yeah.
number one. It's your family. You probably know somebody in your family that needs our services. It's the people who service. It's your hairdresser. It's all your construction people, small business owners who can't afford or not big enough to afford Blue Cross Blue Shield and regular health insurance. And so what this group of people historically do is they delay their health care first. They put it off because it's not in the budget. And if they get sick enough, they go to the emergency room. And
that's astronomically
that's
expensive.
The highest cost primary care you could do. And it's also ineffective because there's no real follow-up from there.
Right. Yeah, I went into the emergency room 6 months ago because I blew myself up. And it was a $1,200. Yeah, I was burned to still, have some things. But it was $1,200 just to go get some cream. And they were trying to force drugs on me. And do you want to take this? Do you want to take that? I was like, wait, I'm not getting hooked on this stuff just for I blew myself up.
Well, and if you can think of your budget is so tight, and you're trying to pay your rent, buy food, get the kids things, gas for the car, and you're juggling all this, what's going to fall out first is usually your health care.
That's right.
Because it's just a non-essential to a lot of people. That's their attitude. That's what they've lived. And so to be able to give them a place where they have a primary care they have primary care doctors, they have access to all these other things, is a huge change in their overall health care. It's a change in their financial status.
So we've talked about healthcare and what you provide to the community, but let's talk about, I mean, your whole life has been philanthropic. and if Jesus wouldn't have changed your life those many years ago and redirected your path, I don't know, I like doing philanthropic stuff.
Yeah.
And I like doing it because I give because he gave to me.
Exactly.
It makes you feel good, yeah. Like the other day, I heard a podcast on somebody saying every time they go out to eat, if they don't have at least $100 to give as a tip, they don't go.
Mm-hmm.
So I thought I'd try it. I'm like, oh, this sounds good. The meal's $25,
This is
$100, huh?
This is Joey.
Yeah, I figured I'd try it, And so I asked for my bill, and the lady is like, because we forget some of these small things, right?
Yeah.
$100 is a lot of money.
Yeah.
But for some people, it's an absorbent amount of money.
Yeah.
It really will change their whole life. And so, yeah, I said, okay, the bill was $25. So I gave the lady a $100 bill. I didn't quite meet the $100 tip, but she just starts weeping. I didn't know what to do, so I got up and left.
Yeah.
And like things like that. So you do philanthropic work like this. We held Smoke on the Farm here.
Yeah.
And we give because one, he gave to us, but because if I can't go and be a doctor, it's my job to send.
Right.
That's what we've always been told. If you can't go, then send, right?
Yeah.
And so what have you noticed in your 20 some odd years of doing this? What is it? Yeah, 20 some odd years, 22 now. What has it done to you? Like you've served humanity for 20 some odd years.
But it's always a matter of the heart.
Yeah.
God's all about the heart. And, my first 20 years of practice in medicine or whatever, my heart was good. I think I had a good inheritance, a good legacy from my great-grandfather all the way down. And they were always taking care of people. I remember my dad told my brothers and I, all three of us doctors, that we'd never practice medicine like he did. And because he had gone from the 50s all the way through, no insurance, Medicare, all these things. And the one thing, and he was right, by the way, he was right. But this is the closest I can come to what my father did, what my grandfather did, what my great-grandfather did. They took care of whoever walked in the door, whether they could pay or not. And, it's incredibly such a blessing to you if you do that for somebody else.
It is.
Jesus came not to be served, but to serve. And, all throughout the Bible, that's what we're to do. We're to serve. The Great Commission, the Great Commandment, everything is about serving others. My wife Tammy and I were talking the other night about in John 13, Jesus says really kind of his last act was to take off his robe and take a towel and get on the ground and wash the feet of his disciples. Yeah. The lowest position, that's the lowest job anybody could do in a home. He even washed the feet of the disciple that would come back and go against him, Judas. And if Jesus, God's Son in flesh, can do that, why can't we? And why shouldn't we? And so it's been a huge blessing all my life to be able to do whatever I could in private practice and now in Victory Health Partners. My passion and my sphere is healthcare. Your sphere and your passion is totally different. Everybody has a sphere and an area that God's given you, and he's given you the giftings to do it. He's giving you the power to do it, and He will absolutely enable you to do it all if you just say yes.
So how difficult was it? Because you see a lot of people that watch what you're doing and watch what other organizations are doing or watch what other people building businesses are doing. Not many people say yes.
Yeah.
And so how do you take that leap of faith into saying yes?
You just jump on off.
Yeah, that's right. I know that to be true.
It's kind of like you understand this. I mean, you look at where we're sitting. This is a giant leap of faith. At some point, you have to trust God.
Yeah.
That you have to trust yourself that you're hearing God. You have to trust God in what He said and what He's promised, and you know this is His plan, not yours. And you can say no.
Yeah. I heard somebody say the other day, I may not be God's first choice, but I definitely want to be His last one.
I want to be a choice.
Yeah.
I'm not sure which one I want. I don't care.
Just make me a choice.
Just make me a choice. And He'll always honor that. Obedience He always honors.
Yeah.
And we've looked at it. Like I said, we could not do it. We really knew that in our faith that we would be disobedient if we didn't do this. And has it been easy? No. Been lots of hard times, lots of ups and downs, and COVID and recessions and malware attacks,
Employees.
employees. It's all that's not easy. But again, where's your focus? If we get into all that's going on around us, God sustained us through 2008 recession. God has sustained us through a malware that attacked and took all of our information.
Yeah, I remember that.
And through COVID, we stayed open every day. And we kept our employees employed and working and serving whoever we could serve. That's what God will enable you to do with a yes. And we have to, every morning we say yes again, just like you do. Every morning you say, yes, I'm going to do this again today because God's asked me to do it.
Yeah, even sometimes you say yes, but really you think to yourself, there's no way.
Yeah, I know.
I do not want to do this anymore.
We had the skeptators all over the place.
Yeah.
And they look at you and listen to you. And long before we had anything, we didn't have a building, we didn't have anything. Here were, Jethro and Ellie Mae, Tammy and I going out and speaking with everybody in healthcare, and they were wonderful to listen to us. And so many of them kind of looked at us and they kind of went, "You're nice people.
Yeah.
It'll never work.
Yeah.
It'll never work." And but we just knew.
So how do you combat those voices that seem to echo whenever you go through a malware attack, employee issues, donor things? You're like, okay, maybe they were right. This isn't going to work.
Maybe it's not going to work.
But you really have to every morning do your best to put on the mind of Christ.
Yeah.
And sometimes it just takes grit to keep going.
Yeah. Sometimes
right?
you just have to pick yourself up and go. But you also, one of the great things that Tammy and my wife, she always comes right to the point. And one of the things you look at is look back. Look, what are the markers in your life? And in Victory Health Partners, we can look at every marker, and we can go back 25 years really, and we can look at, okay, well, look what God did then.
Yeah.
Look what God did then. We were in a bad situation. Look what God did then. And we can always rely on that. We can always go back to that and know if He's done it once, He'll do it again.
So you have some exciting new builds and new expansions that you want to do.
Yeah.
You want to talk about that a little bit, or?
Yeah, I mean,
it's
I'm not
really
young anymore.
Yeah, it is.
Let's look at the reality
This
of it.
building is like 4 times the size
Yeah.
of what you're doing, and you can house a lot of different organizations inside of this building.
The biggest thing that God really started talking to us, I mean, most people look at us and go, well, when are you going to retire? And I always come back, I'm not being flippant, a servant never retires. And we came to a point where we needed more space for the clinic itself to be able to do what we do. But the greatest need in healthcare, and has been, and since COVID has exploded, is mental health care. And we don't have the room to do what we need to do to serve that part of healthcare, especially in our patients and their families. And so we knew that to do that, we had to have more space. And we had to be able to bring it under one roof, which is a really unique experience, a unique model of having your doctor and your counselor and your psychiatrist and your your nurse practitioner all in one place instead of scattered all over the place. But also mental health from the perspective of, what does the Bible say?
Yeah.
What's the Word say? And then how do we treat it from there? And so that's the biggest part of it. But also being able to, partner with other great Christian nonprofits and other folks to bring them under one roof as well.
And we were just talking to Paul Prine about some of the mental illness and homelessness and things that are happening. How amazing is it that you can come, get your surgeries taken care of, hear some news that, hey, look, things aren't what we expected. I know that you're by yourself, but we also have counselors you can talk to as well,
Right.
that are Christ-centered, that can give you the truth and walk with you, versus going to a doctor that's driven by having to make the bottom line work.
Right.
It's really amazing. So that's why I've been a champion. I know there's some, what do you call them? Not naysayers. Skeptators that really do not want the new building to happen.
Well, I think it's time.
I do too.
It's always God's
and so
time.
I am 100% for it.
Yeah, and things have to be in place, and we knew that when we started Victory, things were put into place, and so we're still working toward that. And when God's time's right, it'll be right. Yeah. I know we're to do it, and I know that Tammy and I are committed completely, 100%, 150%. We're to do it. We're to go through this. And we're to get to that point, and then we'll see what God wants to do.
Yeah, and I think it's wisdom, because we've talked about some this before. I'm like, well, let's just go buy it. It's not a problem. God is going to do it. Let's go. You're like, no, just wait. I'm like, do it like this. No, just wait. Yeah. And so I've learned a lot from you, and a result of our nonprofit called Farmers in Action, as a result of you guys encouraging me to do something, and Tammy saying, hey, we need to set up this organization. It'd be really cool if you started this. And so you guys are planting seeds in my life, and have continued to plant seeds into other people's life, and I would equate them to being like mighty oak trees, and that are going to give shade to generations for generations to come. Like you look at these oak trees that are out here, and it all started with a seed, and you started this with a seed in 2003.
Yeah.
And so as a son, as an adopted son, I'm going to make sure, do my dead level best to make sure that it continues on, and that I champion for what we're doing, because I believe in this.
At some point, we had to look at, is Victory Health Partners supposed to go on in perpetuity, forever, or until Jesus comes or the world ends?
Right.
And we answered that question years ago, and we said yes. It is supposed to go on long after Tammy and I are gone, long after the staff that's there now is gone. And so we have to look long term at that. And it is, one of the great things that I love that we do is we have lots of students that are pre-professional students, pre-med, pre-whatever, and they come and volunteer and work with us, and we have residents that come, and we have these folks that are in training of healthcare. And so part of the legacy that we do is to instill in them, okay, this is a different kind of healthcare, but this is really what healthcare should be.
Right.
And it is a legacy. I want my legacy, our legacy, and Victory Health Partners' legacy to continue on to glorify God. And that's our real purpose.